Hello, welcome to the Diagnostic Imaging Center. This is the part of the hospital where kids come to get an MRI. MRI stands for Magnetic Resonance Imaging. The MRI is a large, special camera that takes pictures of the inside of your body. When you come for your MRI, you will meet many new people and have some pictures taken with this special camera. But, just like a regular camera that you may have at home, this camera won't touch you and it won't hurt when it takes pictures. When you first arrive, you will check in at the desk in our waiting room. The receptionist will give you a wrist bracelet that has your name and birthday on it, and some paperwork for your parent or caregiver to fill out. After your paperwork is done, you may have to wait in the waiting room for a little while. This is a good time to play, watch a video, or just hang out with the people who came with you. You may bring a toy or an activity from home to do while you wait. Some ideas are a tablet, a small art project, a toy, or your homework. While you are waiting, a child life specialist may stop by to meet you. A child life specialist's job is to make sure that you understand everything that will happen while you're at the hospital and help answer any questions you may have. You can also ask the receptionist to page your child life specialist if you want to talk about your MRI. It's really important to hold very still while we take your MRI pictures. So we may give you a sleep medicine called anesthesia. This medicine helps you to fall asleep and hold still during the MRI scan. It is usually given through a tiny flexible tube that looks like a straw. This is called an IV tube, and it goes into your vein, usually on your arm or hand. If you will get sleep medicine through an IV tube, it is important that you don't have anything to eat after midnight. You may have clear liquids up to 2 hours before sedation. You will also go to the Child and Adolescent Center to have your IV tube placed before you come to the MRI area. You can talk with your nurse or child life specialist if you want to learn more about the IV tube. When it's time to get ready for your MRI pictures, the MRI team will call your name and walk you and your parent or caregiver to another waiting area. Here, you will meet a nurse who will ask you and your parent or caregiver some questions. Who will also give you a special pair of pajamas to wear. If you have an IV tube, your nurse may say she's going to flush it. This just means she's going to check and make sure it works well by putting special water in it. Some kids think it feels a little cold. You will also meet the MRI technologist or tech. This is the person who will take your pictures. A doctor called the anesthesiologist and a nurse anesthetist are also part of the team taking care of you during your MRI. It is their job to give you the sleep medicine that will help you to fall asleep during the MRI. They will ask you some questions too, like when was the last time you had something to eat or drink? Remember, you can't have anything to eat after midnight. You can have clear liquids up to 2 hours before sedation. When it's time to take your MRI pictures, the tech will ask if you have any metal on you, such as jewelry or a belt. Then the tech will walk you and your parent or caregiver to the MRI room. The MRI is a large round camera with a hole in the center. Kind of looks like a spaceship or a giant donut. The MRI camera is just like a big magnet, so it's important that nothing with metal on it comes into the room with you. You will see a special bed that looks like a table. This bed moves in and out of the MRI camera. Remember, the MRI camera will not hurt and it will not touch you. The tech will help you climb up onto the bed and get comfortable, give you a warm blanket if you are cold, and have you wear a special seatbelt. The anesthesiologist will put some monitors on you to help watch your breathing and your heartbeat while you are sleeping. We will put a blood pressure cuff on your arm, some stickers on your chest and tummy called EKG leads, and a Band-Aid with a red light on your finger called a pulse oximeter. Once you are on the bed and comfortable, the anesthesiologist will give you the sleep medicine through your IV. You will start to feel very sleepy and will fall asleep quickly. Your parent or caregiver can stay with you until you fall asleep. When we are done taking your MRI pictures, the anesthesiologist will stop the sleep medicine and help you wake up. You'll be in a different room and your parent or caregiver will be there with you. After you wake up, you can have a drink of water or juice and something to eat. When it's time for you to leave, we will remove your IV tubes unless you have something else scheduled that day. Then you can change back into your regular clothes and leave. A special doctor called a radiologist will look at the pictures. This may take a little while, so you might not know the results on the day you have the MRI. When the results are ready, the doctor will talk to you and your parents or caregivers. Now that you know what to expect with your MRI, there are some things you can do at home to prepare for it. You can think about which parent or caregiver you would like to come with you on the day of your MRI, and Choose a special activity or a favorite toy to bring with you. Also, there's another video that we suggest you watch. It's about having an MRI scan, but without anesthesia. Sometimes you and your anesthesia team may decide that you can do the MRI scan without anesthesia. We will let you know ahead of time if your MRI scan will be done with or without anesthesia. If you have any questions or worries, please talk with your medical team or your child life specialist. Thank you for watching.